Peace be upon you. I hope you all are doing well. After the age of 50 to 60, your teeth start to break down, which is called tooth wear, and your mouth begins to feel dry. The area around the necks of your teeth, which is the gum line, starts to develop pits. The teeth begin to chip, and they start to demineralize. So in today's video, I'll share some things that you already have at home, maybe even in your kitchen, but you might not know the correct way to use them. You'll be surprised when you hear this. These are such important things that you'll get exactly what you really need. You won't have to go to the dentist for a filling, and your teeth will naturally repair themselves, which is going to be a huge benefit for you. So make sure to watch this video carefully until the end. Like and subscribe to the channel and share it as much as possible, because today's video is extremely important and a lot of research has been done on this topic. I've put this together after gathering research from many days. The area around the neck of the teeth has very thin enamel, and when we start scrubbing it hard with a hard brush like this, defects or pits start to form at the gum line, which is the level of the gums. These are called abrasions. We keep following this routine. We pick up a brush and keep scrubbing it on our teeth every day. Even if the brush is soft, but if our brushing technique is horizontal like this, your teeth will get damaged. The gums start to recede from their place, which exposes the lower layer of the tooth, the dentin, which is sensitive. This gives bacteria a pathway, just like our skin acts as a barrier. If you remove the skin, all the infections will spread throughout our body. Also, if the enamel wears down or the root cementum comes off, exposed dentine tubules act like tiny channels. Bacteria travel through these to the nerve, causing damage. This causes sensitivity to hot and cold and a sharp sensation. Whenever you eat anything, you'll feel a jolt like an electric shock, and eating or drinking will become difficult for you. But the treatment for all these issues is present in today's video. You just have to follow it for a while and you'll be amazed that your teeth will automatically start getting better and will remineralize within 7 days. You'll get about 25 to 40% benefit within 7 days, in just 1 week. You'll get total relief within a month, but the early changes will start showing up within 7 days. So what do you need to do? You need to pay close attention to this, because in old age, the biggest problems are grinding your teeth or clenching them tightly at night, having a dry mouth, and weak teeth. As we age, changes occur throughout our entire body, so our teeth also start to become weak, the enamel begins to thin, and the color of the teeth starts to get darker. So what should we do? The very first thing is coconut oil. Now, what should you do with it? This is very important. It's quite popular in general, and in every video you hear about coconut oil pulling for 20 minutes and your mouth will be fine, but there are some issues with it that are very important to mention. Coconut oil contains lauric acid, which is a very strong antibacterial and antibiotic. It can reduce the bad bacteria in your mouth by up to 8%. It's a very small amount, but it does make a bit of a difference in your mouth. Your mouth gets cleaner, the sticky layer of dandruff-like stuff also decreases, and your teeth start to get a little whiter. But the real issue is that it's like cleaning your floor at home while your roof is leaking. The benefit is very limited. In the same way, the benefit here is also very limited. However, if you use it in a certain way, it can be more effective. And what is that method? For the best results, you need to start by taking some unrefined, cold-processed coconut oil, measure out a full tablespoon, and then place the oil directly into your mouth. After that, gently and slowly swish it around inside your mouth. Make sure you don't do it too forcefully or quickly like this. Just keep it slow and gentle. If you do it too forcefully, your gums, which are already sensitive, damaged, and delicate, will get worse. That's why you need to do it gently and slowly, not quickly. And always, after this, you should clean your teeth with a soft brush. Don't brush before doing this, otherwise it will harm you. That's why I've always said that first thing in the morning, take a tablespoon, put it in your mouth, and swish it around well, gently and slowly, and then spit it out. Do this for 2 to 3 minutes at first. That's enough for you initially. Gradually increase the time as you go. So this was the very first method in today's video about how to fix tooth decay in old age. But out of 10, I would only give this 2 points because it only slightly reduces the level of bacteria. It doesn't actually repair the teeth. How the repair actually happens, I'll explain in the next points. After that comes the second point, which is magnesium glycinate. Remember the full name because there are other salts as well, but they aren't beneficial. They don't get absorbed. Magnesium glycinate is a very important thing. What happens when you have a deficiency of it? When you sleep at night, your muscles become tight, your jaw starts to ache, and you begin grinding your teeth at night, which is called bruxism. Because of this, the indentations on your neck, the pores, the tiny notches, they start to become even deeper than before, and this is very dangerous. After the age of 60, there is a 60% chance that people will have a magnesium deficiency, which causes their muscles to cramp and leads to the habit of grinding their teeth. For this, you need magnesium. What benefit will magnesium provide? At night, your teeth grinding, clenching, and tightly shutting your jaw, all of this will go away. And you'll be surprised that within 8 weeks, this habit starts to decrease by 15 to 20%. Gradually, you just need to be consistent with it. You will need 400 to 450 micrograms 45 minutes before going to sleep. Remember this dose. When you're about to go to sleep, you need to take this dose 45 minutes beforehand, 400 to 450 milligrams. Then the problem you have with teeth grinding will be resolved. But just make sure that in old age, with the kinds of illnesses that come after 60, like blood pressure issues, if you're taking blood pressure medication, consult your doctor before taking magnesium glycinate, because there's a chance they could interact with each other. So you absolutely need to remember this. Magnesium glycinate is really a magic thing, but it doesn't actually repair the tooth. So what is the deal? The process of tooth breakage, which increases 3 to 4 times due to teeth grinding. When you grind your teeth, the teeth are already weak at the gum line and will break even more. This helps reduce that. In other words, it'll reduce the contributing factor, but it won't repair the teeth. I would also give this a 4 out of 10. Now, the third thing that comes up, which is very important, and I mentioned it, is xylitol. But along with this, there's something even more important, mineral water. Not filtered water, because when you highly filter water, it removes all the minerals. So what is it? Xylitol plus mineral water. This is a really good combination. And what's the benefit of it? With this, the problems you face between the ages of 6 to 60 get repaired 66 to 7 times faster. That's how quick the results are. And how does this repair happen? Let me tell you the method. You must have noticed that after the age of 60, your mouth starts to become dry. When your mouth becomes dry, remember there's a natural mouthwash in your mouth called saliva. It contains calcium phosphate, which coats your teeth and repairs them. When your mouth is dry and there's no saliva, your natural repair process stops. Because of this, your notches, the pits, and deep spots will start to worsen 3 to 4 times faster. So what you need to do is use xylitol. It increases saliva by 32%. If you chew it just once, your saliva secretion will increase by 32%, or 32 times, within just 20 minutes. So what you need to do is, after eating, chew it for 5 minutes, and then, as I mentioned, take the mineral water, the highly mineralized water that you bought, just 1 bottle, and keep sipping it throughout the day so that minerals accumulate in your mouth. Xylitol also kills bacteria, delivers minerals to the teeth, and increases saliva production. For those who have a dry mouth, it's a wonderful blessing, an ideal thing. I would give this combination a score of 6 out of 10. Now, there's some very important points coming up, so watch carefully. This is very informative. If you search on Google, you'll find plenty of literature and articles about it. Xylitol plus mineral water is a very strong combination. Now, let's move on to the next point, the 4th point, which is very important, vitamin K2 plus vitamin D3. It's commonly seen that in old age, people keep chewing calcium and take vitamin D, thinking their teeth will get stronger, but the reality is quite the opposite. The role of vitamin D is that it helps with the absorption of calcium from your intestines during digestion, but where does this calcium go? It goes into the blood, into the arteries, and keeps circulating here and there, but it doesn't go to the teeth. So how do we get it to go towards the teeth? For that, we need vitamin K2, which contains a special enzyme called osteocalcin that will carry your calcium to the teeth and repair them. This is a really magical thing, which is why it's been observed that 36% of tooth repair happened within 12 weeks, as proven by research from the European Journal. 36% is a big achievement. It was observed all over the world that in Japan, people over 60 years old didn't have as much tooth decay, their teeth didn't have as many cavities, their teeth were strong, they didn't get damaged or fall out. It was found that people there mostly consume more vitamin K2, which carries blood calcium into the teeth and strengthens them. And how much should you take? Vitamin K2 and vitamin D3 are basically fat-soluble vitamins, so you should take 100 micrograms of vitamin K2 and 2,000 international units of vitamin D3. Along with that, you can have nuts or avocado, because when you take them with a fat-soluble diet with fats, the absorption happens faster since they are fat-soluble. But one thing you must remember at the end, if you are taking any blood thinner, like warfarin, make sure to consult your doctor as well, because this can interfere with it. Your blood could become too thin, and you could face problems. Now, let's move on to the next point, the fifth one, which is also very important. A natural mouthwash? It's an amazing thing. You'll be surprised. It contains baking soda, along with aloe vera gel, and even more importantly, clove oil. As soon as you use baking soda, the pH, which is usually above 5, a level at which minerals start leaching out of your teeth, immediately gets neutralized. Baking soda stops this process right away, brings the pH up to 7, which stabilizes your teeth and prevents further damage. Besides that, it kills bacteria, plus the aloe vera gel should be pure, not the kind you get from the market. You need to cut a plant yourself and extract the gel from it. And what will this gel do? It'll reduce gum inflammation, stop bleeding from the gums, and even help your gums start to grow back. That's a very unique feature of it. And the third thing is clove oil, which is extremely important. It contains eugenol, which blocks sensitivity, eliminates that electric shock-like feeling, and relieves tooth pain. After using it for 2 weeks, about 45% of your sensitivity issues start to decrease. So what do you need to do? Start by taking half a teaspoon of baking soda, carefully add 1 teaspoon of aloe vera gel to it, then add 2 drops of clove oil, and take 4 ounces of lukewarm water. Thoroughly mix all of these ingredients together, and you'll have a natural mouthwash. Keep it in your mouth after every brushing. Since we brush twice a day, morning and evening, hold it in your mouth for 60 seconds after brushing. Swish it around like this, and then spit it out. You'll get amazing results from this. I'd give it 6 out of 10 because the results are pretty good. But now I'm going to tell you about the top thing, which is actually number 1. Although it's number 6 cereal-wise, in terms of results, it's number 1. And what is it? It's nano-hydroxyapatite plus xylitol plus magnesium. These 3 things. If you combine these 3, you'll never have any problems. I mentioned how to take magnesium before going to bed at night. It also has a unique rule, a principle. All these things are not something you get instantly from nano-hydroxyapatite. With a soft brush, you should brush your teeth by holding the brush at a 45-degree angle and gently brushing, just like this. Apply toothpaste with nano-hydroxyapatite. So, nano-hydroxyapatite particles form a shield on the outside of the tooth. They bind to the teeth. If you have pits or holes in your teeth in different places, these particles physically bind to them. They create a layer, and this isn't a foreign body because our teeth themselves are made of hydroxyapatite. Our bones are made of hydroxyapatite, so it's a part of the body. So when we use it, it will repair the surface of the teeth and create a shield, so you won't need a filling. It greatly increases the micro-hardness of natural teeth. The result observed is that it repairs so much that it increases the micro-hardness of teeth by 34%, and that too rapidly. Within a few days. Within 10 to 20 days. What does xylitol do? It increases saliva production in the mouth, speeds up repair in the mouth, and what does magnesium do? It reduces teeth grinding. If you use the combination of all 3 things, you'll never have a problem. Your teeth will become amazing. Now, how should you do it? First of all, when you wake up in the morning, you need to use coconut oil. After that, take a soft toothbrush and using nano-hydroxyapatite paste, brush your teeth gently from top to bottom at a 45-degree angle. Then use the mouthwash I mentioned, which contains 3 things: aloe vera gel, baking soda, and clove. After that, you can head off to your office or wherever you need to go. In the afternoon, after you eat your meal, chew xylitol and keep drinking mineral water throughout the day, the kind that contains minerals. At night, about 45 minutes before going to bed, take the magnesium tablet I mentioned, 400 to 450 micrograms, and all your problems will be solved. I've shared these very simple methods with you, and finally, there's one thing I absolutely want to mention, something you need to avoid. Number 1, whenever you brush your teeth with nano-hydroxyapatite toothpaste, you shouldn't rinse your mouth afterward. Just apply it in your mouth and spit it out. Because it'll only be effective while it's on your teeth. That's when you'll get the benefit. So keep it on for 40 to 45 minutes. After that, you can rinse your mouth. The second important thing is, if you're using a mouthwash that contains alcohol, you shouldn't just throw it away. You simply shouldn't use it because alcohol dries out your mouth. And when your mouth is dry and saliva isn't produced, the repair process in your mouth stops. And the most important thing is that you have to wait 6 to 12 weeks. You need to maintain consistency. You'll keep noticing early changes. When you start using it, you'll see that after 7 to 10 days, at the level of your gums, you'll notice white lines forming, like a layer. Those are minerals being deposited on it. Gradually, that'll go away, and your tooth will regain its hardness. So I hope the information I gathered for you today was very informative and will be helpful for you. You can ask any questions in the comment box below. Thank you.